Hi there! We are the Infection Prevention and Control Committee, dedicated to ensuring the safety and well-being of both patients and healthcare providers. Sa araw na ito, kami po ay excited na maipamahagi ang latest developments and updates patungkol po sa ating safe injection policy. This policy is at the forefront of our efforts upang mapanatili ang kalidad na serbisyo natin patungkol sa healthcare safety. Ang aming committee ay lubos na nakatuon upang ang bawat isang kawani ng Jose R. Reyes Memorial Medical Center ay ma-inform at ma-involve sa ongoing initiatives namin patungkol sa patient safety at infection prevention and control. Please stay tuned as we share important insights and updates on our injection safety policies and procedures. In this video, we will be giving you a comprehensive guide on safe injection practices of our institution. Kung ikaw ay isang healthcare professional, pasyenteng nagsa-self-administer ng medication, o simpleng naghahanap ng pangunawa sa kahalagahan ng ligtas na pag-injection at makaiwas sa bloodborne infections or injury, ang video na ito ay magbibigay sa iyo ng mahalagang kaalaman at gabay to ensure IV injections are carried out safely and effectively. Here are our safe injection practices. We start with the basic step, proper hand hygiene. Healthcare providers must consistently clean their hands prior to IV medication preparation and also before and after every injection. Please always perform proper hand hygiene and the 5 moments of hand hygiene. Ang palagiang paghuhugas ng mga kamay ay mahalaga upang maiwasan ang pagkakaroon ng kontaminasyon. Ito ay simpleng paraan lamang, ngunit mahalagang hakbang sa pagpigil sa pagkalat ng impeksyon. Next is, prepare medication in a designated, clean, and controlled environment using aseptic technique. Tiyakin na ikaw ay nagpe-prepare ng gamot sa isang malinis at maliwanag na lugar at sa designated area for medication preparation. Mag-prepare ng gamot sa tuyong surface at malayo sa sources of contamination tulad ng sinks o surfaces na madaling matalsikan o mabasa ng tubig. Ang medication area din dapat ay malinis, organized, at free from contaminated or infectious items during preparation that could have come in contact with blood or body fluids tulad ng mga soiled equipment na may dugo, ihi at iba pa. In addition, parenteral medications are prepared using aseptic technique. Ang lahat ng healthcare providers po should strictly perform aseptic techniques when opening packages, transferring medications, and mixing solutions. Gumamit lagi ng bagong sterile syringe every time na magpe-prepare at magbibigay ng gamot. Iwasan na makontaminate ang mga needles, syringes, at vials ng gamot para mapanatili ang sterility ng IV medication or injection. We also emphasize po na ugaliin na magsuot ng gloves lalo na kapag humahawak ng sharp items like syringes and needles o habang gumagawa ng procedures na high ang risk for transmission of blood-borne infection. Another aseptic technique is to disinfect rubber septum with 70% isopropyl alcohol. Ugaliin na linisin ang labas ng rubber septum ng vials o ng ampoules during preparation at ang IV ports at tubings tuwing nagbibigay ng gamot gamit ang sterile alcohol pads with 70% isopropyl alcohol. Ito ay para maiwasan makontaminate ng microorganism o makompromise ang mga rubber septum ng vials o while breaking the ampoule. Siguraduhin din na matuyo ng tuluyan ang pinahid na alcohol bago po mag-insert ng needle sa vial o magbigay ng gamot sa IV port. Sunod naman po ay, medication containers are entered with a new needle and new syringe, even when withdrawing additional doses for the same patient. Gumamit po ng bagong sterile needle and syringe every time na mag-aspirate ng gamot sa mga vials o medication containers. This helps maintain the integrity and sterility ng mga medication within the container. It is not recommended na gumamit ng same needle and syringe sa pag-withdraw ng gamot galing sa iba't ibang medication vial because of the risk of contamination of the contents. Kung ang isang vial kasi ay contaminated, maaaring mapasa ang mga contaminants nito sa ibang medication containers or IV solutions kung hindi ka gumamit ng bago o magkahiwalay na syringe o needle sa pag-withdraw ng laman nito. And also, contaminating the medication can alter its effectiveness or even cause adverse reaction when administered to the patient. In addition, isa sa mga pinakamahalagang strategy ay ang pagsunod sa single-use rule. Una, use sa single-use syringes and needles. Tulad ng nabanggit kanina, kinakailangan na gumamit ng bagong stereo syringes and needles for each injection. Again, huwag o bawal gamitin ng isang karayom o syringe for multiple use or patient o para sa higit sa isang pasyente. Second, it is recommended to utilize single-dose or single-use medication for one patient only. Gumamit po ng single-dose medication vial or ampule ng gamot o IV solution na intended lamang sa isang pasyente. If in case na ang isang gamot ay maaaring ibigay in multiple doses, ito po ay dapat intended lamang sa iisang pasyente o kung kinakailangan talagang gamitin sa maraming pasyente, please take note ang paglinis ng rubber septum with 70% alcohol at paggamit ng bagong syringe kapag nagwi-withdraw ng gamot sa vials. And always take in consideration po ang validity o expiration date ng mga IV medications. Third, do not reuse medication administration tubing and connectors. This is for the reason na ang mga reused IV tubing and connectors ay may natitirang gamot o tuyong dugo within the tubing and connectors even after use. Ang mga natirang gamot sa tubings ay maaaring mag-provide ng suitable environment for bacterial growth and biofilm formation, which further increases the risk of infection and contamination. It is recommended na kapag gumamit po ng Soluset sa pagbibigay ng IV medications like antibiotics, ito ay dapat pinapalitan every 3 days. Next is, inspect vials and discard if sterility is known or suspected to be compromised. Tingnan ang laman ng gamot sa vials, bottles, or ampules for particulate matter, discoloration, or turbidity. If present, huwag na po itong gamitin at i-discard immediately. Furthermore, prepare IV medications as close as to administration as possible. It is recommended to prepare IV medication or injections as close as possible sa time of administration nito sa patient. This is to prevent compromising the sterility or physical and chemical stability of the medication kapag nabuksan na ang container nito o naka-incorporate na for a period of time before administration. Ang recommended time sa pagbibigay ng gamot ay dapat within 30 minutes o depende sa manufacturer's specifications. It is highly recommended na gumamit ng 3-way stopcock for side drips in administering medication or in multiple IV infusions. Ito ay importanteng hakbang ng IPCC upang mapaigting ang pag-iwas natin sa needle stick injury sanhi ng mga needles na ginagamit as connectors sa IV tubings o Soluset. Ang 3-way stopcock po ay already coordinated and readily available sa ating central supply department. Another thing is, do not use spiking devices even if they have a one-way valve to withdraw fluid from IV bottles or bags for multiple uses or patients. Spiking a bag, vial, or bottle of sterile fluid as a dispensing device and leaving that device in place to withdraw medication for multiple patients increases the risk for microbial contamination. Another thing is, one-way valves in these devices may not be foolproof. There's still a risk na makontaminate ang laman nitong IV fluids. Ang contaminated IV fluids, if given to your patient, maaaring mag-lead to infections or other health complications. In connection with this, never leave a needle, cannula, or other spike devices inserted into a medication vial or IV diluent rubber stopper. Reminder po, bawal na hayaan o mag-iwan ng needle na nakatusok sa IV bottles for the purpose of getting diluent for multiple uses. Ito po ay maaaring maging direct route for microorganism to enter the vial and makontaminate ang fluid. This is the reason why we highlight the use of single-dose containers of flushing solutions and single IV diluent in reconstituting medications. Ugaliin natin na gumamit ng single-use water injection as diluent o pangtunaw ng mga powdered form na gamot sa vials. Ito po yung mga 10 ml na diluents na maaari nating makuha o mahingi sa pharmacy department. We would like to give emphasis po na please refrain po sa paggamit ng 1 liter plain NSS as diluent dahil available po sa pharmacy ang mga single-use IV diluent. Please coordinate with the pharmacy department para makahingi po kayo ng supply ng 10 ml sterile water for injection. Furthermore, the committee does not advocate pooling or combining leftover contents of vials for later use. Kasi po, pag pinagsama-sama nyo po ang mga leftover medications from multiple vials, it becomes difficult to accurately determine the exact dilution and dose each patient is receiving. This can lead to underdosing or overdosing, which can have serious health consequences. Moreover, there is also an increased risk of contamination from the opened or partially used medication vial. Also, proper labeling and storage of multi-dose vials or reconstituted medication is important para madaling makita o malaman ng date kung kailan nabuksan o na-mix na ang solutions and especially ang validity o expiration date ng prepared na gamot. The recommended validity date ay 28 days. Ito ang typical na shelf life ng medication that is expected para mapanatili na stable and effective ito for that duration when stored under appropriate conditions. However, it can also vary depending on the manufacturer's specifications. We emphasize the strict adherence to these expiration dates para masigurado ang safety ng mga pasyente at ang epektibong epekto ng mga gamot. Medications or solutions that have exceeded their validity date should be discarded properly and not used on patients. In addition, always affix the name of the person who prepared the medication. This provides accountability and allows for tracking the preparation process. Discard all open vials, IV solutions, and pre-prepared or open syringes on their respective waste containers. Ang mga vials po o IV solutions na natanggalan na ng septum seal at hindi naubos o completely nagamit should be disposed of properly. Ang mga used needles, syringe, and other sharps items ay dapat carefully and properly i-dispose sa puncture-proof containers. Sundin po natin ang ating hospital protocol sa tamang pagtatapon ng mga sharp items and syringes. And lastly, assign a glucometer device for each patient. If this is not possible, please make sure na ang mga devices na ito ay malinis at properly disinfected prior to each use. And this brings me to the end of our safe injection practices. Ngayon po, it's time to put this knowledge into practice. Tandaan niyo po na ang safe injection practices should become our second nature. Stay updated po sa mga latest guidelines and inaasahan po namin ang patuloy niyong kooperasyon at suporta upang mapanatili o ma-improve pa ang ating mga practices patungkol sa patient safety. Please encourage your colleagues to do the same upang ang bawat isa ay maging advocate for patient safety. Paigtingin pa natin ang ating pagnanais na makapagbigay ng kalidad na serbisyo sa pamamagitan ng safe injection practices na ito para sa kaligtasan hindi lamang ng ating mga pasyente kundi pati ng ating mga kasamang healthcare professionals. Together, we can ensure that every injection is a safe one. Stay safe and maraming salamat po.